The helping relationship. Regardless of what population you work with, having a strong therapeutic relationship or a strong rapport with your clients is an essential part of the helping process. Modern counseling models and techniques are as varied and diverse as the counselors and clients who use them. Most counselors have a particular theory or theoretical orientation, method, or school of thought that they embrace, whether it's cognitive behavioral therapy, solution-focused therapy, a strength-based model, holistic health, person-centered theory, Adlerian, or one of the many others that exist. Yet, all of these approaches and techniques have at least one thing in common. Their potential effectiveness is likely to be minimized unless the counselor is successful in building a strong therapeutic alliance with the client. The nature of the therapeutic alliance is not a new idea. In 1957, Carl Rogers wrote an article in the Journal of Consulting Psychology outlining the factors that he considered necessary for achieving constructive personality change through therapy. Carl Rogers' theory, or person-centered theory, is the cornerstone of building a relationship with clients, and that alone can serve as a catalyst for client change. Rogers asserted that the therapist must be genuinely engaged in the therapeutic relationship, have unconditional positive regard for the client, feel empathy for the client, and be able to clearly communicate these attitudes. In the decades since Rogers' article was published, many other studies have explored the therapeutic alliance. In 2001, a comprehensive research study published in the Journal of Psychotherapy found that a strong therapeutic alliance was more closely correlated with positive client outcomes than any specific treatment intervention. Most individuals who write about the therapeutic alliance describe three important factors: goal consensus between the counselor and client, collaboration on counseling-related tasks, and emotional bonding. Therapeutic rapport refers to that connection that the client and the counselor have in the professional relationship. Counselors love their techniques and interventions. However, this research really shows how important the therapeutic relationship is in creating client change. It's critical for the counselor to learn the client's worldview in order to enhance cooperation in the counseling process. It's also difficult to accomplish true change unless the counselor is listening to what the client wants, not what other people think the client needs. Allowing the client space while simultaneously trying to establish connection and ultimately an alliance sometimes requires a bit of creativity and a lot of patience on the part of the counselor. Validation and acceptance are also necessary parts of the therapeutic alliance, regardless of the client population. Allow room for feedback, and keep checking in every so often. By making space for clients to give feedback about the counseling process itself, the therapist shows acceptance of the client's sincere feelings, both good or bad. Simply asking a question such as, "How are we doing?" or "How are these sessions helpful?" gives clients the chance to express themselves, while conveying the message that their reactions, positive or negative, will be heard and respected. Sometimes, despite attempts to offer respect, validation, and space, the client and counselor still don't click. This doesn't necessarily mean that the relationship cannot be successful. Let the client determine what is most important, and talk through what might be helpful to change the process. Remember, to work well with a client, it is essential to establish rapport. Rapport is important regardless of what counseling model you use or theoretical orientation that you subscribe to. Unless a client feels a sense of rapport with their counselor, they will be unlikely to be able to work well with the counselor. Rapport will be helped and facilitated by how the counselor manages their own feelings towards the client and how they behave with the client. You need to think about being well prepared for sessions, making a safe and trusting environment, being aware of who the client is, knowing their name, remembering key things about their issues, and making note of any cultural considerations. Offering empathy, being unrushed, patient, and allowing the client time and space to explore their problems. Having an accepting demeanor, meaning no matter what the client says, we need to remain unshocked no matter what they bring. We need to be non-judgmental, offer unconditional positive regard, and maintain respect of the person throughout, even if we don't necessarily condone their behavior. We also need to be congruent. We need to be honest and accepting, yet gently challenging dysfunctional beliefs and behaviors when the time is right. There are characteristics of good helping relationships. That strong rapport that is built on trust and respect, having a good relationship from the start, making sure that we as the counselors aren't getting our own needs met in the helping relationship. The counseling process is about the client, and we need to keep the focus on the client. We need to be caring and have a positive, optimistic view of not only the client, but of the client's potential solutions and outcomes to their problems. We need to collaborate with the client and also be centered on strong communication. We need to uphold all ethical codes and take confidentiality very seriously. We need to allow the client to maintain their autonomy and let the sessions be guided by the client's needs. We need to set goals and provide structure while also being able to be flexible. Ultimately, we need to focus on thoughts, behaviors, and underlying feelings. There are factors that we have as counselors or helping professionals that help promote good helping relationships. And these are some of those qualities. Being empathetic, that unconditional positive regard, genuineness, and authenticity that Carl Rogers talked about. We need to be trustworthy, culturally competent, open-minded, have a good sense of humor, healthy boundaries, be patient, sensitive, and warm, and have a commitment to personal growth and self-care. There are also client factors that promote good helping relationships. A client's readiness for helping is one of the most important factors, and it will be based on one of the stages of change. Either pre-contemplation, not really aware of the problem yet. Contemplation is the stage before anyone's really ready to do anything about it. They're just acknowledging the problem. Preparation is acknowledging the problem and having some steps in place to be able to start to deal with the problem. Action is when a client is really doing the work in order to alleviate symptoms that they're having or work towards solutions to the problems that they're experiencing. And maintenance happens after some resolution of the problem, but there needs to be coping strategies and other things put in place so that the client doesn't fall back into a pattern of unhealthy behaviors. Clients also need to be active in the process, be patient and persistent, even though there may be some setbacks or challenges along the way. They need to maintain positivity and also be willing to be vulnerable, expressing both emotion and be willing to self-disclose. There are helper factors that hinder the helping process. We, as the helping professional, need to be aware to avoid these factors. Defensiveness, being aggressive or demanding, using sarcasm with clients, interrupting clients, judging, criticizing, or blaming them, being self-indulging or getting our own needs met, assuming things about the client or the situation, advice giving, stereotyping, interrogating, manipulating, overanalyzing a client's problem or situation, ignoring client concerns, or avoiding talking about client feelings, using distracting behaviors, and ignoring cultural factors. There are client factors that also can hinder the helping relationship. If a client's not ready for help or ready to do work, that can greatly hinder the counseling process. If a client has excessive defensiveness or resistance, it is not atypical for clients to have some level of defensiveness or resistance at some parts in the helping process. But if this is it will create a very challenging environment for the counselor and the client. If clients have negative perceptions of counseling or are not really involved in the process, if they're impatient and want change immediately, or have unrealistic expectations of the counseling process, if they have very little emotional expression or are really unwilling to self-disclose, if clients have some significant impairment or distress that they are unable to work through to really get to the problems, or if they have a sense of learned helplessness. As helping professionals, we have an opportunity to really have an impact in clients' lives. It's important that we go into the helping relationship being positive and optimistic while also having a spirit of excitement that we can help someone improve their quality of life. At the end of the day, a counselor's authentic desire and determination to connect may be at the heart of the therapeutic alliance.